Alrighty. Hello, everyone, to NSO Day 3. Today is Friday, August 27th. We're so happy you can join us today for this very important NSO session. Today, you will be hearing from student rights and responsibilities, Title IX, campus safety, health and wellness, as well as student accounts. Thank you for being here. This session will be recorded, and if we experience any type of Wi-Fi issues, we will hope to jump back on as soon as we can, but we will let you know. With that being said, I'm going to pass it over to Jessica Karen, the Director of Student Rights and Responsibilities, to start our session here today. Jess?
Thank you, Fran. Hello, everybody. My name is Jessica Karen. I am the Director of Student Rights and Responsibilities here on campus. She, her pronouns are they, them. Today, I'm going to be talking to you about what SRR does, along with my two graduate assistants who will introduce themselves in a moment. And essentially, the name is what it sounds like. We are about your rights here on campus according to the Code of Conduct, as well as your responsibilities to the community around you. We really center around this idea that yes, there are policies, there are rules of being a community member here at Lewis and Clark, but what we're concerned about is you thinking about the impact that you make on yourself and the people around you while you're a student here at Lewis and Clark, and you make the community what you want it to be here at Lewis and Clark. And we help facilitate conversations around that. We help deal with conflict resolution, and as well as a number of other things on campus. So today we're going to talk about that, and I will share my screen here in just a moment. And we will present. Okay, so the four topics that we're going to cover here today are student conduct. So what are our processes? What does SRR offer in terms of services for you to help with conflict resolution on campus? What are some common policies that we often see come through our office and we want you to be aware of going into the school year? What is the Welfare Intervention Network? So how do we assist with health and safety matters and taking care of our community members outside of conflict? And then finally, we're going to toss it over to the Office of Equity and Inclusion and Casey Beaver to talk about Title IX intersectional misconduct policy. So it's a big agenda. We'll have a break in the middle for Kahoot, where you're going to have an opportunity to win a prize. And yeah, we're going to kick it off from there. Fran, does everything look good on your end in terms of what you can see?
It sure does. Thanks, Jess.
Thanks. Okay, so SRR and student conduct. This is our team in the Office of Student Rights and Responsibilities. Like I said, my name is Jessica Karen. I'm the director. She, her, hers, pronouns are they, them, theirs. I have been here at Lewis and Clark for the past 4 years. This is my second year in this director position for student rights and responsibilities. And before that, I used to be an area director for campus living, and I oversaw Stewart, Odell, and Aiken Hall. So shout out to all my SOA folks out there. Love that. Outside of SRR, I really enjoy reading tarot. I have cards here today. If you ever want a really bad reading, come and see me. I play D&D on a regular basis with some friends in Portland, and I love a good book and art and going to McMiniman's theaters in town and seeing a movie. So yeah, I'll pass it over to Lucas to introduce themselves.
Hi, everybody. Excuse me, sorry. My name is Lucas English. I go by he, him, his pronouns. I'm a second-year graduate student at the Lewis and Clark Graduate School of Education and Counseling. I'm in the Student Affairs Administration program. I'm originally from New York, so I've transitioned from the East Coast over to the West Coast for my education. And outside of Lewis and Clark, like Jess, I'm pretty much into a lot of like nerdy stuff. Like I have a lot of toys right here. I'm at my house zooming right now. So if you ever want to talk about anything like that outside of Lewis and Clark, I'm here for that. So I'm going to pass it to Rose.
Hey everyone, my name is Rose. I use she, her, hers pronouns. I am a first-year graduate student at the Lewis and Clark College Lewis and Clark Grad School Student Affairs Administration program. And I actually graduated from Lewis and Clark as an undergrad in 2020. Feel free to talk to me if you're interested in talking about history or ancient languages or anything like that. If you want to go down that path, be happy to chat with you about it. And then outside of school, I love arts and crafts. If you want to talk about sewing or any sort of paper craft or anything in that realm, I would love to.
All right, thank you both. Besides us, we all serve as resolution coordinators in our office, which is just a fancy way of saying we're hearing officers for different policy violations or dealing with conflict resolution. We also have 5 additional resolution coordinators who are your area directors and campus living. So I'll talk about how they fit into that. We also are anticipating seeing some other resolution coordinator volunteers coming on from the law school. So connecting our 3 campuses together to help support students dealing with conflict resolution. So this is our website. I just wanted to put our information up there. Later when we play the Kahoot, you're going to email a screenshot of your winning, like if you win, you're going to send your winning screenshot over to the SRR at lclark.edu. We are down actually in the campus living suite. So if you've gone down there for a room concern, we're actually in that same office. So you can ask for any of us at that point. Be aware that we're currently in person. If COVID guidance change, we may resume remote work, but you can reach us by shooting us an email, and that's the most easy way to get a hold of us. And then when you might see us, so the most common reason why we see students in SRR is for policy violations on campus. We have 2 kind of hearing processes that we handle, and that's our informal process or agreed resolutions and our formal process called administrative hearings. Most students, I'd say about 75%, only see us for the informal process or agreed resolutions process. In both, they're scheduled by your LC email, so keep an eye out for an email from what we call Maxient. It's our software that we use in our office, and we can have those meetings in person or on Zoom. We'll schedule it for you in person. You just need to reach out to us if you don't feel comfortable with that given COVID, or if it works better for you to do that over Zoom or it's more comfortable. In these meetings, regardless if they're informal or formal, we center on less of this idea of policy violations being a breaking of the rules and more of what harm is caused to you or others when a policy is violated on campus. So identifying and naming those harms and then working with you to identify where you hold responsibility. How do you want to address those harms and how do we move forward? And we do this, all of our resolution coordinators are empathetic. They're not there to judge you about what you did. They're more to help you have a conversation and reflect and educate you on those policies that we have on campus. So that's what you can expect when you meet with any of us. Again, the people who oversee these cases are resolution coordinators. If you live in Hall and you have a minor policy violation, so say your first alcohol policy violation or cannabis on campus, you'll likely meet with your area director. And the reason why we do this is because us in SR, we don't live in the residence halls. And so when you do something and it impacts the community around you, I want you to meet with people who live in your community, and that includes your area directors who live in the buildings with you. If you were to have a second policy violation in your community of the same type, you may end up meeting with our new Community Accountability Council, which is actually students who live in the hall with you and are impacted by your actions. So those are 2 of our informal options for you if you live in hall. You may end up meeting with us as well, depending on how busy things are, or if we have a time that works better with your schedule in our office rather than your area director, things like that. The real difference between those informal meetings and our formal ones is that in an informal meeting, we're centering on you coming to an agreement with us. You saying, I take responsibility for doing this. I know that I did this. I know that I was documented for it. And here's how I want to make it up to my community. And here's how I want to reflect. Doesn't need to be a paper. It could be apology letters. It could be helping your ROA with your bulletin board. It could be an art project if that's what inspires you and helps you reflect. It can really be a number of things. But ultimately, you're working with your resolution coordinator to make that decision. Now, a formal hearing, which is for higher level policy violations, or more repeat violations. We still have similar conversations, but our office ultimately makes the determination of if you're responsible for violating a policy and what that outcome is going to be. We still try to center your voice in that and center the voice of the person harmed, but it's a little bit more formal, and that conversation is recorded in a little bit of a different way. So those are the main differences for those. Beyond adjudication though, so beyond hearings, we offer a number of different options for conflict resolution. So sometimes when a policy is violated on campus, say your roommate is playing music really loud after quiet hours and it keeps you up at night and you have an 8 a.m. the next day, maybe you don't want to see them get in trouble. You don't want to see them go through the adjudication process, but you do want to see something happen so that this can be resolved, and you don't know how to do that yourself. We offer a number of options to you, both informal and formal, to address conflicts like that on campus. We can help you with dialogue for your roommate and things like that. We can also help facilitate a dialogue. So maybe you don't want to see any particular outcome, but you just don't know how to have that conversation. We can help you do that. We can also host mediation. So you do want to set some agreements between you and that other person, and you want us to facilitate that conversation. We can do that. Your RAs can also do that, and so can your area directors. And then we're working on incorporating more restorative practices as well. There's a student group on campus called Prison Abolition LC who's been working on bringing restorative circles and larger community conversations around harm. So we've been supporting them in their efforts to get those things off the ground, and we're hoping to offer more of that in the future. And then shuttle diplomacy. So you have a conflict with someone, but you don't want to interact with them directly. We can meet with you and meet with that other person separately and kind of go back and forth until an agreement or a resolution can be made. So this is what we call the spectrum model of options. It's available to you to use. There's also a number of different people on campus who you can go to for conflict resolution, like the ombuds person, Valerie White, or like I said, your area directors or RAs are also trained in those things as well. So we're just another option for you in that. If you're interested in helping with any of these things or learning more about how to do them yourself, get in contact with us. We're really interested in working with students who want to help make their community a place where we can talk about conflict and concerns that we have, because ultimately that's about relationship building. Relationships aren't just the pleasant things that we deal with. It's also the things that we come in conflict on, the things that we have competing needs on, and the way we have conversation about that makes our community stronger. So. Finally, one of the other ways you can see us is by getting involved in student governance. I have made it kind of my role here in the director position to get students involved in, if you have a policy that you think needs to be changed, having an opportunity to talk about that. If we're going to be changing our letters here in SRR that you get when you're called in for a meeting or something like that, we want to have student voices included in that, and we're going to pay you to do that. So if we put out a call for volunteers, sign up. You might get like a $25 gift card or some other opportunity to give your feedback in this process. And finally, the new Community Accountability Board or Community Accountability Council. This is a group of students who live in the community and are interested in talking about conflict and policy violations and things like that. And it's a great way to, if you want to become an RA in the future, learn about policy, learn about how to manage relationships. Right now, it's only open to students who've completed one semester here on campus, but in the spring, we will be recruiting for first-year students. So if you're interested in hearing more about that, reach out to us. And finally, we're holding a raffle. We don't want to just see you in here for policy violations or things that are uncomfortable. We'd love to chat with you. Like I said, I'll do a bad tarot card reading for you or whatever that might be. So we're holding a raffle between now and September 17th. If you come in by that day on 4 p.m. and chat for just a couple minutes, doesn't have to be anything long, with myself, Rose, or Lucas, we will put you down for a random drawing raffle where you can win a $25 Uber Eats gift card. We're going to select 3 winners on the 17th and email them out probably that following Monday, since it's a Friday. So we'd love to see you down here. Again, we're in the basement of Templeton, room 110, or you could set up an appointment to come and see us too and just talk about what are options available to you on campus. With that, we're going to switch over to policy violations, and Rose and Lucas are going to talk to you about some common things that we see on campus that you should be aware of what the policies are around them.
Hi, yeah, so next what Jess said is we're just going to talk about common policy violations that can happen when you're a new resident on campus. So yeah, I'm going to give it away to Rose.
Alrighty. So first off, I just want to say we're not trying to trick you into violating policy. We're not trying to get you on technicalities or anything like that. Our mission is to give you all the information you can possibly have in order to kind of be the most aware of the policies and your responsibilities on campus. So I strongly recommend that all of you read through the college policies online. You can find it by going just to the SRR website and clicking student conduct and college policies. Some of them are a little more complicated than others, but generally, if you just read an overview of each of them, I strongly recommend that. So definitely check those out. And that's what we'll be referring to in any policy violation cases.
So we are going to touch base on 5 policy violations. That's alcohol and drugs, the noise violation policy, the hazing policy, the directives policy, and then our newest policy that's changing throughout the semester and probably the years, our COVID-19 mitigation policy.
Alrighty, first off is our alcohol policy. So I'm sure you all know the drill. If you are under 21 in the United States, you're prohibited from possessing, consuming, or being under the influence of alcohol. You also should not be holding on to empty alcohol receptacles. And a lot of times this policy comes into play when people are using empty beer bottles or something as flower pieces in their windows. So just keep that in mind. Also, just even if you are above 21, keep in mind that being visibly intoxicated on campus, or having open containers in public spaces, or having things like beer bongs, any of that is also prohibited. And this isn't written on the slide, but I do think it's really important to touch on. We do have a medical amnesty policy. I'm sure you maybe have heard a little snippet about that, but essentially what that means is that if you're with someone who is in an alcohol or drug-based emergency, we want to make sure that you are not punished for getting them the help that they need. We want to really make sure that everyone's health and safety is the #1 priority on campus. So if you are involved in a drug or alcohol related emergency and get help for someone, you have the option to discuss it with someone from the Office of Health Promotion and Wellness rather than a conduct hearing. There are some additional criteria, like you have to stay with the person until they get help, until given permission to depart. But generally, I think that's a really important policy we have on campus and something to be aware of. So yes, please, even if you're underage and you're breaking policy, please get someone help who needs it.
Awesome. So for drugs, the college prohibits the unlawful use, possession, cultivation, manufacture, promotion, or distribution of controlled substances, including cannabis, by the College of Arts and Science students. So cannabis is legal in Oregon if you're 21 years older and you're using it in a private residence. Lewis and Clark is still federally funded. So that means any financial aid you receive from the college, we get from the federal government to offer to you. So if we don't follow that policy and the compliance by that, they can take that away and we won't be able to offer that to any of the students at our schools. So that's why cannabis is still considered illegal on our campus and why it's still considered a policy violation. Any paraphernalia related to the controlled substance, so like a bong, a pipe, any type of thing like that, and it has any used resin and it tests positive, that's going to be a policy violation on campus as well. And then finally, if you have any prescription drugs from a provider that is legally able to prescribe them, you're allowed to have those on campus. Just make sure they're locked up and that you don't give them out, distribute them, or abuse them in any way, because that is also going to be a violation.
The ever exciting noise policy. I will say that this is one of the most common policies that's violated on campus. So just be aware that the quiet hours that are posted in your residence halls, they're the same for every residence halls, from 10 p.m. to 10 a.m. Sunday through Thursday, and then on the weekends from midnight to 10 a.m. Keep in mind that you do need to respect those. That's part of our campus policy. Courtesy hours are also in effect 24 hours a day. So what that means is essentially if you're blasting music down the hall at, who knows, 2 p.m. and everyone in the hall can hear it, that is violating the courtesy hours noise policy, because people could be sick, they could be studying. We want to make sure that you have a safe and quiet place to study and to sleep. So definitely talk with your RA about what that means for you and your hall specifically, but just keep in mind that everyone's just trying to live and study and sleep here. So do your best to be respectful. And yeah, if your neighbor is being too loud, feel free to knock on their door and ask them to quiet down, or you can call your RA.
Awesome. So I'm going to touch base on the hazing policy. Hazing is defined as any act which endangers the mental or physical health or safety of a student, or which destroys or removes public or private property for the purpose of initiation, admission into, affiliation with, or as a condition for continued membership in a group or organization is prohibited. So basically, if anybody is telling you that you need to do something and it makes you uncomfortable and it's really like hardcore, it's most likely hazing. And it doesn't just happen in Greek organizations, it happens in clubs, sports teams, and other groups on campus. And then what you can do is notice hazing. If you see something, say something. Don't be afraid and trust your instincts. If it doesn't look right or it feels wrong, say something about it. There are people on campus that will help you with it. Also interpret hazing as a problem. It's not something that should really exist, and it is a problem. Also, campus is your community, so you should be supporting a safe climate, and hazing isn't supporting a safe climate.
For our directives policy, the long story short is essentially if a college official or someone who's a law enforcement officer is acting in performance of their duties, is doing their job, and gives you a request or a directive, you got to meet that request or directive. The big one is like if your RAs are on duty and ask for your IDs, show them your IDs. And this also includes just kind of requests to meet for appointments with faculty offices, admin offices, with our office, and going to your disciplinary investigations and hearings if you have those. And again, like Jess mentioned, we'll assign outcomes based on if the policy violation occurred and things like that. Make sure you comply with those outcomes and get them finished by the due date. And COVID guidelines also fall into these asks, so make sure you follow those COVID guidelines.
Finally, so yeah, the COVID-19 mitigation policy is the one that's going to be changing throughout the year, depending on what the college puts forth, or what the state, local, or federal circumstances are. So basically, failure to comply with the COVID-19 related requests or directions of college officials acting in performance of their duties is prohibited. So if anybody at a college asks you to do something like take a COVID test or anything along those lines, you need to comply with that. This includes, like Rose said, check your emails. That's mostly like where the communication is going to be. So make it like a daily occurrence of checking the emails.
Alrighty, we are going to go ahead and go into a Kahoot. It will cover most of what we talked about in this presentation, as well as a few other things. And the winner gets the fluffiest Lewis and Clark blanket in all the land, high quality blanket. So there's a prize. Alrighty, let me go ahead and share my screen.
That's for the top 2 winners. So if you got second place, we'll give you a blanket as well.
Alrighty, there's a game pin. Go ahead and join. Hanson, I like the use of emojis. Same, Anna. Alrighty. Okay, we're gonna give it one more minute and see if anyone else is gonna join. Alrighty, last chance, everybody. Okay, let us go ahead and get started. First question, which of the following is not part of our SRR mission? Yeah, exactly. Our goal is not to punish people who violate policy to the fullest extent. We really want to work with you all to kind of hope you learn, help promote equity and inclusion, educate for civic leadership, and also just kind of protect the welfare of the community and individual. Alrighty, here we go. Here is our next question. It's multi-select. Where can you find the college policies? Yeah, so policies can be found on the SRR website, like I mentioned, and also in your settling in handbook that has a lot of details about the campus living policy specifically. If anyone wants to make a tablet of policies and hide it under the bridge, I mean, clear it with facilities, but you will get 1,000 rose points redeemable for 1 crisp virtual high five. So we got some change ups. True or false? Cannabis is legal in Oregon, so it's fine to have on campus. Yeah, so as Lucas mentioned, Lewis and Clark gets federal funding, and what that means is we have to abide by all federal laws, and since cannabis isn't legal federally, it's not legal on campus. Oh, Harry is the highest climber. Good job, Harry. When are courtesy hours in effect in your residence hall? Yeah, courtesy hours are in effect 24/7. A little bit of a tricky one, but just keep in mind, so courtesy hours are just, again, to maintain a comfortable study and like resting place for people in the residence halls. Essentially what that boils down to is just like, don't be excessively ridiculously loud. Specific quiet hours are 10 p.m. to 10 a.m. each night during the week and midnight to 10 a.m. on the weekends. True or false? SRR will call your parents/guardians if you meet with us. Yeah, great. I'm glad to see that so many of y'all answered false. Yeah, we're not going to tell your parents if you meet with us. Your information and your records once you become an undergraduate student are protected actually by law, by FERPA. So what that means is if your parents call to say like, hey, my student has met with you, tell me what they said, we can't. We'll tell them to talk to you directly. If you want your parents or guardians to receive your records, you can fill out something with the registrar for that. But in general, we're not going to tell your parents. And also aren't going to spread, if you meet with us, we're not going to spread it around campus or anything. Good job, Max. Which of the following is not a violation of the academic integrity policy? Yeah, so if you qualify for extra time for tests, definitely meet with case management about that. They'll talk about things in just a second. But you absolutely are, sorry, I have not had coffee today, y'all. It's a fun time. But you absolutely are welcome to do that. And that is not a violation of the academic integrity policy whatsoever. We're staying about the same. Let's see. What is the conflict resolution model we follow? Yeah, like just mentioned, it's called the spectrum model. I definitely recommend checking it out on our website. Oh, Luce is back with an answer streak of 3. Good job. If you live in a residence hall, who is usually your resolution coordinator for minor policy violations? Yeah, your area director. So your RAs are often the first people to respond to an incident and to write a report about a policy violation. And they're also there, a great resource to reach out to. But because the resolution coordinator process is a little more professional and has like a little more training involved, that will go to your area director first. And then for those administrative hearings, it'll likely go to one of us in the Office of SRR. Oh, we got some change ups. Okay, true or false? There can't be hazing at Lewis and Clark because there's no Greek life. Yeah, exactly. Hazing can be anywhere. So just keep an eye out for it. What does the CAC stand for? This is a little bit of a tricky one. I don't think we mentioned the acronym. Yeah, the Community Accountability Board or Council, I apologize. Yeah, so those are people in your residence hall. They're students who have been here for at least 1 semester, and they will meet with you in the event of like a second time minor policy violation. MEMA 3000 is back. If you are over 21, which of the following is allowed according to the alcohol policy? Yeah, if you're over 21, it's totally fine to have open containers of alcohol in private spaces, provided that only you or people also over 21 are in there. Rachel is back. Which of the following is not a violation of the directives policy? Yeah, so all of these other things are violations of the directives policy, but filling out a survey your RA sends out about just hall stuff is not technically a violation of that, but it is rude. So if your RAs work hard on those, please fill them out. A lot of times they're fun. Pretty, Mika has the highest answer streak. What can you do if your neighbor is being too loud during quiet hours? Yeah, awesome. I don't think this one needs too much explanation. Just know that there are options available to you. Casey is back. True or false, if you don't check your email and miss health directives, you could be in violation of the COVID policy. Yes, yeah, be sure to check your email. Like Lucas said, check your email daily, not just for your classes, but also for health directives and things like that. Mac Attack is back. Alrighty, last question, everybody. Where is our office? Yeah, Templeton 106. That is also where the GA grad assistant cave is. Feel free to say hi. If we were in the back of the bone, I would never get any work done because of the cookies. So awesome. All righty, here's our podium. Third place, congrats to Mika or Micah. Second place, we got Olivia. And first place is Sky. Awesome. Great job, y'all. So if you got first or second place, take a screenshot of your little of your podium screen and email it to srr@lclark.edu and we'll get in contact with you about getting a prize. Ready.
All right, thank you, everybody. So we are just gonna wrap up our conversation with you. I'm gonna present again with information about the Welfare Intervention Network. So the Welfare Intervention Network on campus deals with concerns about health and safety issues for members of our community. This is not run out of the office of SRR, so if you interact with this group, you're not in violation of any type of policy or things like that. But in my role as director of SRR, I facilitate this group on campus, so I'm providing information about it. The Welfare Intervention Network, or WIN. This is a group of Lewis and Clark professional staff members from a number of different offices, not just SRR. So while I facilitate, we also have representatives from inclusion and multicultural engagement. We have athletics, we have Office of Student Accessibility and Case Management, we have the counseling services, international student support services, just a number of different campus partners who serve on this committee. And what we do is when we get a report about a student who may be at health or safety risk to themselves or others, whether that's a physical risk or whether that's a mental health concern that they're dealing with, we address those reports and end up reaching out to these campus partners to see, one, this is a small campus, so you likely have a relationship with a staff member somewhere on campus who might be best supporting you, or there are specific services that someone on that group is going to be able to provide you best. And so they will reach out to you. Sometimes we'll do informational interviews, so we'll reach out to a reporting party. Reporting party can be you as a student if you're concerned about a peer. And get some more information. We'll check in with community members. So on occasion, we might ask your area director to stop by your room and check in, or your RA on campus. And then we might have you, if you're the student of concern or your friend is a student of concern, meet with those support systems that we have in this group, so that they can get you connected with resources. We try to minimize the amount of people that you're going to meet with, because we know that that can be overwhelming when you're already dealing with something like a crisis. But what we can do is help you navigate the system in Lewis and Clark, and get the things that you need. We also have connections in the Portland community. So Amy Milne from the Office of Case Management is a major part of WIN and can help you get connected to providers for medication off campus, counseling services off campus, psychological services off campus. So there's so many options available to you, and Lewis and Clark is really great about supporting you. We have faculty member who often check in with us, but I want you to know that you as a student can be concerned about your community and report that to us too. To report a concerning situation, go to the welfare intervention page on the Lewis and Clark website. There's a big gray button right there in the center of the screen. When you go on the WIN page, it says report a concerning situation. You just click that and fill out what's going on. If we need more information, we'll reach out to you that way. But again, with everything else we do, whether that's dealing with policy violations, supporting someone who's going through a health and safety crisis, we want you to look out for each other, because we're a community here at Lewis and Clark and we care about one another. And so it's important that we take those steps to get people involved if they need to be. All right. So now I'm going to flip it over to Casey for Title IX. Casey, if you want me to flip slides or if you want me to remove the screen, let me know. But thank you, everybody, and I look forward to seeing you this year in many different capacities on campus.
Thank you, Jess, and flipping these slides is great. Hi, everyone. My name is Casey Biebrick, and one of my roles here on campus is as the Title IX coordinator. And what that means here, you can flip to the next slide, is that I'm the person who you can speak to if something is going on. I'm the person who responds if we get a report about potential sexual misconduct. And I'm also the person, if there is a question about, is this or is this not under the policy? What can I do? What resources can I get? How can the school help me? How do I make a change? What if this is impacting my class, my housing, something else about my experience here? So you can reach me by email. My office is in Templeton 248. And you can also reach me by phone, set up a Zoom. We've got a lot of ways to be in touch this year. So I am not inside the SRR office, but I work closely with SRR. We are always making sure that the right person is reaching out and offering the right options to a student. You want to go to the next slide? So you all will receive a lot of information at various points about sexual misconduct, the Title IX law, and about consent, which is a key part of all of these definitions. If you go and read our policy on the website, it is pages and pages about what is consent, and you'll also be learning that through some lessons you may have already done online and some workshops in person. So in general, sexual misconduct includes stalking. In simple terms, that's someone following you online, sending threats, being in any way threatening, or making you fear for your own safety. Another thing covered by our policy is violence by an intimate partner. We do not care what your dating status is, how you would define your relationship. If someone who you are in any kind of intimate relationship with is doing you harm, whether that's physical harm, psychological, verbal abuse, withholding, keeping you isolated from the people who care about you, any kind of abuse, that is something that we are concerned about and want to help with. Any type of non-consensual contact, non-consensual sexual acts, anything where you didn't agree to it, you expressed in some way you didn't want it, or you didn't show that you were interested in that contact. And again, you'll learn a lot about what is consent, but in general, you want the people who you're having any sort of intimate or sexual contact with to want to be engaged in that. Consent matters at the start, it matters ongoing, and it has to be freely given, not under any sort of threat or fear. And then we also have a bunch of other things that can be sexual misconduct or sexual harassment. That includes things like taking a picture when someone didn't give permission to take a picture, taking a video that someone didn't give permission for, sharing a picture or video. So even if it was consensual to have that picture or video, if someone didn't say you could share it with someone, post it, that is also something that we're concerned about and could be a policy violation here. And then sexual harassment or gender-based harassment means that someone is repeatedly, unwantedly asking you for some sort of sexual contact, asking you on a date over and over when you've said, no, I'm not interested, or making harassing comments about you, your body, your sexuality, your gender identity, gender expression. These are all things that we want to know about and help with. So one thing to really be aware of as you're learning about all of these things is that sexual misconduct, any of the things I just listed very quickly, can happen to anyone, and that conduct can be done by anyone. So if you have a picture in your mind of who you think usually experiences stalking, who usually does stalking, who usually experiences sexual harassment, who's usually responsible for sexual harassment, we know that it may be more common for some folks than others, but it can happen to anyone. So just because it is not the person you expected to do this doesn't mean that it's not real, that it's not really happening, and it is definitely something we want to help you with. So if you can flip to the next slide. We have lots of resources listed on this website. It's /healthy-relationships. There, it will connect back to our policy page, to the list of folks who can help you with these concerns, and I'm on all those pages as well. So one thing that we get a lot of questions about is if I reach out, or if my RA reaches out, or someone says something to the Title IX coordinator, what's going to happen? So the first thing to know is that if you are concerned that someone may have reported your conduct, you will absolutely know if we are conducting an investigation, looking into it, going to talk to you about something. You will receive formal notices on letterhead. You'll get pinged in your email and by text message, assuming we have your cell phone on record at the college. You will know if something is happening. There are no surprises in this. Like your amazing SRR folks said earlier, we are not trying to trick anyone. We are not trying to catch anyone off guard. We want everyone to know what's expected here at Lewis and Clark, what behavior is unacceptable, and to know what will happen if we are encountering that behavior. If something is happening to you or to someone you care about, you can reach out to many resources on campus. If you reach out to me, I am required to follow up with the person who is impacted. If you don't want me to do that, then we can always talk about a situation without using names. You can come and call or meet with me in my office or online. We can talk about if this thing is happening, what should I do? And then we can talk about options, next steps. what you can do. And at that point, I can say, I'd really like for us to offer some resources to this person. Can you tell me who they are? We can talk through all of those things. So if you're ever worried about what is or isn't going to happen, please reach out to the folks who care about you, reach out to me, let's talk it through, and then we can make sure that the school helps out with what is needed. If someone does let us know that there's potential sexual misconduct, they heard about something, they saw something, or their friend or student is acting differently and they're really concerned about them, that might go to WIN. If there's some indication that it is because of sexual misconduct, that will come to me. What happens next is that we reach out. It's usually an email to start with some follow-up after, but we'll reach out and say, this person let us know that there's a possible concern. We'd like to talk about what you need. How can we support you? What would you like to see happen? What can we do to address what's going on to keep you safe? And if needed, to support you in other ways. So we can assist with things like if there is someone in your class who has been harassing you, if you need to switch classes, retake an exam, if your activities or work have been impacted and you need us to get an excused absence or make an adjustment to the location. There are many things we can do to plan around keeping you safe while we figure out what to do next. So my main message today is please reach out if something is happening or has happened to you or to someone else. If you're not sure if it would violate the policy, that's okay. Please still reach out so that we can get you the right resources. That said, because I am considered a private office, that means that there are things that I do have to do, like reaching out to a student we're concerned about. But we do also have some completely confidential resources on campus. So we have confidential advocates. Their information is posted in bathrooms and on some posters, and you're also welcome to reach out if you want their information directly. You're going to hear in a little while from our wellness folks, and they are the people who recruit and send to training our confidential advocates and can tell you more about that. We also have an ombuds office, Valerie White. Again, a completely confidential person you can reach out to with any concern or problem about what might be happening in your experience here or with the school. And we also have folks in our spiritual life office. So spiritual advisors are also considered confidential, as well as any counselor or health provider if you're going to them and sharing something. There is always the disclaimer that if someone is afraid that you will do violence or that someone is in immediate danger, there are some small exceptions to confidentiality for immediate danger. But otherwise, we do have those resources. And if you come to my office, to SRR, to your campus living folks, to all of the people around you who care about you and how you're doing here, we will absolutely guard your privacy. We only share information with people who absolutely need to know. So something like, we need to tell campus living that you need to move a room. We would share that that needs to happen, but we're not going to go sharing a whole story of why that needs to happen. We take it very seriously that if you are going through something like sexual misconduct, that is private and that you would not want anyone to know. And we will tell you what we are going to do. You will have choices all along the way, and it will always be led by what you want to have happen. So you will be learning more about this in different contexts, already have been a little exposed to it, but the important thing today is to know that there are real human beings, people here on campus who can help you if something is going on. And I think I'll be followed by campus safety, which is another resource on campus, especially at night, on the weekends. I'm sure Jose can tell us about who you can call and how to get in touch with them. And then please feel free to visit me, ask for a meeting, or call me by the phone. Thank you.
All right. Hello, everybody. How are you doing? My name is Jose Curiel. I am the Director of Campus Safety. So Campus safety is located at Gate 3 entrance. Many of you have visited our office. We did provide, we do the ID cards and the access to your living quarters. We also, one of the things that I do is I supervise approximately 15 staff members made up of campus safety officers and dispatchers. We are a 24-hour-a-day office, so anything you guys need at any time, there's someone available to speak to. The campus safety officers and dispatchers are responsible for a full range of services to the Lewis and Clark community, including all crime report investigations, medical emergencies, fire emergencies, traffic accidents, safety escorts, and enforcement of all college policies, including those related to alcohol use, drug use, and weapons possession. Campus safety officers write reports on incidents, and those reports are forwarded to the SRR office. All criminal activity, suspicious activity, anything that you see out there at any time, please feel free to contact our office by dialing extension 7777. Or if you're off campus, phone number 503-768-7777. That information is also on the back of your ID cards for our office. Some other services, like I was talking to you about, the IDs, we make IDs, we replace IDs, so if we do lose yours, get a hold of us when we can block the access so that if somebody finds it, they can't use it and gain access into your residential areas. We also, like I said, we provide the access, so if you're having issues with access, let us know. We do lost and found. We also provide vehicle assistance with like jump starts. And we are, since we're a 24/7 department, we get all after-hour calls. So any facility emergencies you're having, call our office and we will get the help that you need. And but other than that, I'm very excited. I don't have any cool prizes to give away. But this is my first year at Lewis and Clark. I'm very excited to be here and to help. And my main message that I want to give is that we are all educators. So campus safety officers are not here to try to bust you. We are primarily wanting to educate the student population so that we can all be safe and make your stay here really worthwhile for everyone. So welcome everybody, and I hope to meet you out and about, and don't hesitate to call and reach out and chat with me. Thank you.
Thank you, Jose, SRR, and Title IX. We now will be passing over to Ami Hannah and those in health and wellness. Ami, are you around?
I am around.
Excellent. Well, I will let you take it away.
Let's see. Do we have our slides?
John sent them in. Do you want me to present them for you?
Would you be willing to do that?
I can absolutely do this.
Great.
Give us 1 second here, folks.
Perfect. Thank you so much. So hi, everyone. My name's Ami Hannah. I am the Health Promotion Coordinator and COVID-19 Specialist at Lewis and Clark. Shortly, I will be joined by my colleagues, John Hancock and Margaret Upton. But I would like to get us started talking a little bit about COVID prevention on campus and how to keep yourself safe and healthy and the resources that are available to you in sort of the COVID world that we're all living in. So you can advance the slide. Great. So this is a great opportunity to take a screenshot, take your phone out and take a picture because these numbers are extremely important. There are a few numbers on here that I think we've already heard about today: campus safety, campus living, but I'd also like to draw your attention to the health service phone number, the health promotion phone number, and the web link for confidential advocates, which we will talk about a little bit later. But maybe we can just pause here for a second so folks can take a screenshot. And we also have printed Pioneer Wellness cards available at different offices around campus if you want to grab one and put it in your wallet for safekeeping. We just want to make sure that folks know where to contact if they need to reach out to anyone for any of these services. All right, we can advance the slide. Oh, I think if you go back one. This is another list of numbers and services that I think folks would really like to have in their back pocket. It has that campus safety emergency number, but it also has our free nurse consultation service line, which I'll talk about a little bit later, the crisis counseling line, suicide prevention lifeline, a crisis text line, and a few other really important phone numbers and resources that we want students to know are available to them. So you can take a screenshot or take a photo of this as well. And of course, you can find all of this on the Lewis and Clark website too. Great. You know, Francesca, I want to pause here and just see if John will join us, because I know that he wanted to talk a little bit about some of this information before we carry on. So I think John just jumped on the call.
Yes, thank you, Ami, and thank you for getting things started today. I want to welcome all of our new students to campus, and we're so excited to have this wellness webinar with you. I wish we could all be together in the chapel, but as I think most all of you know, we tested over 500 new students yesterday in the chapel, so that's why we're still testing today, and so that's why the session is online today. So happy to talk a little bit about COVID and some other wellness issues with you. Again, my name is John Hancock, and I'm the Associate Dean of Students for Health and Wellness, also Chief Psychologist, and many of you saw me running around the chapel yesterday as we executed the testing program. So I wear a lot of different hats at the college. So I wanted to start by talking a little bit about, how do we get through this year together, and especially around COVID. My wish is that college is the time of your life, that it's something you will remember, and that the relationships you develop with Lewis and Clark will stay with you for your whole life. And that's certainly true for many of our students. But at the same time, college can be kind of a stressful experience too. Lots of things that you're encountering that you haven't encountered before, whether they be academic or relationships or financial or family stressors, other things that might arise. So we want to be sure you have the support you need. But this year is especially sort of challenging due to COVID. So I want to highlight just a few things about COVID in my introductory remarks. First of all, I was on a call with Multnomah County Public Health last week, and we were talking about the situation that's unfolding with COVID in Multnomah County. And the bullet points on this slide were things that they shared with me that they felt it important that everybody in the county know. And so I'm sort of a vehicle to let you all know about these things. The COVID vaccines are working significantly. So we are in a very good position this year. Ami in particular and other members of my staff have been watching all of your vaccine records come through. And so we appreciate all of your collaboration and teamwork in getting vaccine documentation submitted. The vaccines work. They do significantly reduce your risk of COVID, but the vaccines are imperfect. And so breakthrough infections are going to happen. And then we have health resources to support you should that occur. But this last point I think is really important to remember, and that is that symptoms of COVID, especially the Delta variant, in people who are vaccinated, can be very mild and they can mirror the common cold. But even if you have such an infection, you can transmit it to other people. So at Lewis and Clark, we're an inclusive community. So we make space. Our goal is to make space for everyone here. And I can tell you that we do have a relatively small number of individuals on our campus who are going to be unvaccinated this fall. They're going to be unvaccinated for medical reasons. Some are going to be vaccinated for religious or other non-medical reasons. But all of them have been carefully vetted by my staff, and they all have a very good reason for not being vaccinated. So it's really incumbent on all of us to be thinking about that and be thinking about how we protect the most vulnerable members of our community from infection. And one of those ways is that if you have any symptoms of COVID, including what seem to be mild symptoms, maybe even common cold symptoms this year, that you don't react like you might normally react. I know for me in a typical year, if I have some very mild symptoms of what might be a cold, I might be tempted to come into the office and get some work done anyway. This year, that's not going to be the case. What I've told my staff is if anything that looks like the common cold, they should go ahead and stay home. And that would be my encouragement and recommendation to all of you too. Stay home, isolate. We have some, Ami will talk about some guidelines for self-isolation in a bit, how to get meals delivered. And then we'll get you some medical consultation and some, if needed, we'll get you some testing. And then we'll figure out what's going on. In most cases, it won't be COVID, but you can't know. There's no way that you can self-assess and determine whether it's COVID or not. So we just ask people to be very careful if they're having any symptoms of COVID. Is Henry advancing the slides on me?
Francesca is.
Oh, Francesca is, okay, excellent. So, you might have a tendency to say, none of us want to have COVID. I certainly don't want to have it, right? And so one of the ways psychologically we deal with that is we have these thoughts in our head. We say, well, this symptom I'm having, this cough, this headache, this sore throat, this congestion, it's not COVID. It's just a sore throat. It's just diarrhea. It's just muscle or body aches. It's just fatigue, right? But really, again, you can't know. So if you find yourself thinking these sort of things, be careful and self-isolate and follow the guidelines that Ami will share, and then we'll get some medical consultation. I want to offer you a story that I heard from another college, and I hope this story will be meaningful to you. So there's a story from another college where there was a party, and the party had maybe 20 students at it. Actually, I don't know how many total people were at the party. I need to say that. But what I do know is that out of that party, there were 20 positive COVID cases that were identified. And about, I think, 8 of those were people who were vaccinated, okay? So my guess is, I don't have a lot of details about the party. It wasn't Lewis and Clark, right? But it did happen, and this is a real and true story. My guess is at that party, people had their masks off, right? There can be still transmission when people have masks on, but my guess is everybody wants the pandemic to be over. They want COVID to be over. They want to have fun. They want to socialize. They wanted to get in small groups. Nobody loves masks. So my guess is a lot of these students got into a relatively small space and they took their masks off and they had a party, which is a great thing to do in a non-COVID kind of year. But in this year, 8 of those students or so wound up to have COVID, but all 8 of those students were asymptomatic. So the problem is you can be asymptomatic and you can transmit the disease, right? So that's why masking is important, even at parties, even in social gatherings, indoors, anytime outdoors, when you're when you're unable to socially distance. So be sure to keep your masks on, and be sure to be careful, and then finally, if you have any of these symptoms, be sure to act as if you might have COVID, at least self-isolating until we know different, right? Next slide. Okay, so just some stats. These may not be the most recent CDC information, but roughly this is kind of what I've been saying, that we have a lot of cases of COVID that are asymptomatic. So if you have this thought in your head of like, well, I feel fine, therefore I could never be infectious, so therefore I'm just gonna rip this mask off and I'm gonna, have fun. Don't do it, because actually some asymptomatic people are infectious. So especially at this time in Oregon, we have so many cases and our hospitals are so full. It's true that younger people have fewer complications from COVID on average. However, we do have vulnerable members of our population, right? Some who may be immunocompromised. We also have faculty who are in higher risk groups and staff who are in higher risk groups. So keep your mask on. It's a good thing. A lot of disease transmission even happens before symptoms onset. So another reason to practice that good masking behavior and good hand hygiene as well. Even our testing strategies are imperfect. So masks and hand hygiene are our strategies for getting through the year. Next slide. Okay, so I think this is about the end of my time, and I'll kick it back to one of my co-panelists. So I want to mention that, again, we do have a few people on campus who have exemptions that have been approved. So we want to act effectively so that we can help support the safety and health of those individuals. For those people who are vaccinated, we want to act in those ways. We are going to be testing the unvaccinated people in our community weekly. We tested everybody this week. I'm not sure we will get to testing all unvaccinated next week or not. Stay tuned. If you are unvaccinated, you will get emails that apprise you of when the next testing is scheduled for yourself. For all students, there is a September 15th deadline. By September 15th, you either have to document proof of vaccination or you have to have an exemption approved. We do have some international students who didn't have access to vaccine in their home countries. We're working to get them vaccinated. But you have to be vaccinated or have an exemption, or have a really good reason, like an international student who's working with us, to get fully vaccinated. If you're not in one of those categories, come September 16th, you won't be allowed to be in class anymore. So be sure to keep that deadline in mind. And yes, I've already mentioned the last point on the slide that we're working with those who didn't have access to vaccine this summer. If you didn't have access to vaccine this summer, we'll work with you to get you vaccinated as soon as possible. Stay tuned for details about that. Next slide. If ever you want to know what the results are from testing programs on campus, or from just how many cases we've had, this on the health promotion website, you can find this link, essentially this page, and so if we post every case to this website, every positive case that we know about. So if you're ever concerned, you've heard a rumor that there's an outbreak, or there's a lot of positive cases, go to this website and check it out. That's the latest and most accurate information about the state of the situation on campus with cases. Next slide. And for the rest of the program, I've already talked about supporting the most vulnerable among us. And I'll have one or two more sentences about that. And then we're going to talk about preparation, prevention, self-monitoring, surveillance, medical consultation services, testing, and then also isolation, quarantine, and contact tracing. So that's what we'll talk about today. Next slide. So protecting those most at risk, kind of already covered this information already. We are all going to act as a community this year to take care of those who are most vulnerable among us. And if you are considered to be a person at increased risk, and you might need to take some extra precautions due to COVID-19, please consider contacting our health service staff, and there's their email address. And also, if you think you might need academic accommodations, please contact Student Support Services. This slide is wrong. That office changed their name over the summer and the slide didn't get updated. So Student Support Services is now called the Office of Student Accessibility, but their email is still access@lclark.edu, and they will help you with any academic needs you might have. Next slide. Great. Ami, this is your section.
This is me. Thanks, John. Hi, everyone. Again, my name is Ami. I handle a lot of the COVID-related stuff that happens on campus, from contact tracing and case management to developing some of these policies and procedures, to looking at every single one of your vaccine cards and making sure that it's in your wellness chart. Next slide, please. So I think that everyone received sort of a list of things to bring with them to campus before you moved. But just in case some of you forgot or didn't hear that we wanted you to have this stuff, I hope that everyone will have or procure a thermometer, multiple well-fitting face masks that you can wear over your nose and mouth. We prefer the reusable kinds. You can wash and rewear them, and we're not generating too much single-use plastic garbage. We'd love it if you had some fever-reducing medication with you, like aspirin or ibuprofen. And then it's also great for you to have a stock of tissues, hand sanitizer, and disinfecting wipes. And the reason we ask you to have this stuff is if you have to self-isolate, or if you're diagnosed with COVID or are exposed to COVID and need to isolate or quarantine in isolation or quarantine housing, these items will help you get through that experience. We can advance the slide. So our first sort of step for prevention is that we want every single person in the Lewis and Clark community to be self-monitoring for COVID symptoms, regardless of whether or not you're vaccinated. And what that looks like is every day before you leave your residence hall, we want you to be self-screening for COVID symptoms before you go to breakfast or go to class or see other people, just to make sure that you're doing sort of a daily wellness check. You can find a list of symptoms to screen for on the Lewis and Clark COVID response webpage. But as John said, they can be mild and really mirror the symptoms of a common cold or stress or allergies. So, things to look for are coughing, fever, chills, shortness of breath, head or body aches, loss of taste or smell, and really kind of just being aware of changes in your health status on a day-to-day basis. Next slide. So if you do have a symptom or a few symptoms that are unusual for you and you want to report them, we want you to first self-isolate in your residence. And there is a webpage on the Health Promotion and Wellness website at the Lewis and Clark website that gives you a full explanation of how to self-isolate, what we expect of you, how to sign up for meal delivery, how to navigate things like shared bathrooms and class accommodations. So you can read that website for more information, but essentially just stay in your room and then log on to the health portal and complete the SCARF form, which I think every single person completed before move-in. And that form, if you report that you have a symptom or multiple symptoms, will send a ping to our health service. They'll know that you're experiencing symptoms and they will reach out to you to help set up a consultation. Typically, they start with a telehealth consultation, and this is just for screening purposes. So there could be a day when you're not feeling so great, you talk to a health service person, and they're able to evaluate you and tell you, nothing to worry about, you can continue on your way, or they might want you to come into the health service for a COVID test. So whatever they advise you, we want you to follow the directions of the healthcare provider that you contact after you complete the SCARF form. Next slide, please. So if you need to access healthcare on campus, the on-campus health service is probably going to be your first stop. This is their phone number, 503-768-7165. And during business hours, you can call to make an appointment, or as I said, contact them through the health portal. If it's after hours or it's the weekend and you have a health question, we have a free after hours nurse consultation line that you can call. That's the number right there, 1-877-617-9531. And that is a great place to start if you don't really know what to do about a symptom you're experiencing, or you need some medical advice or a referral to another place to access medical care. And then finally, if you have a off-campus doctor that you're already seeing, or you want to access care from a place like an urgent care facility, you're welcome to do that as well. We have a list of off-campus providers that take student health insurance on the health service website at the Lewis and Clark website. All right, next slide. And I think Margaret is going to take it from here.
Hello, everyone. I'm Margaret Upton. I'm the Director of Health Service here at Lewis and Clark. Welcome. I want to let you know a little bit about our services related not only to COVID, but to all health experiences you may be having. Our services are confidential and available to all students. You do not have to have the student insurance that the college has provided. You can use any insurance. All of our services are free to students for provider visits. The things we do, we evaluate and treat illnesses and injuries. We also can help students that manage their chronic illnesses. We do physical exams, athletic exams, GYN exams, work exams, and travel physicals that may need done. We do have in-house laboratory services for things such as strep, mono, urine analysis, COVID testing, and we also have referral services for lab to Quest Diagnostics. We administer allergy injections and also will support students with injectable medications that their provider has ordered for them. We have prescriptions. We do have a small in-house pharmacy for certain medications, and we can dispense those right in the clinic. But we also do electronic prescribing to local pharmacies. The closest ones are Fred Meyer and Safeway. They are on Barbara Boulevard. Fred Meyer, the PIO bus goes to Fred Meyer, so that's a nice resource for students. We also do travel consultations and vaccinations for travel, but we also do vaccinations for other reasons too, like tetanus, MMR. We will be having COVID vaccinations for those of you who were not able to access that at home. And we are planning for that next Tuesday. So if you want to call health service next Monday and potentially set up an appointment for your COVID vaccine, we will be offering the Moderna. We also provide referrals to off-campus specialists. We can order radiology for x-rays, CTs, other therapies that you may need. Next slide, please. For our services this fall related to COVID, we are going to have initial visits for ill visits through telehealth. Well visits, if we can offer them telehealth, and that is something you would like, we will offer those as telehealth visits, but we will also have well visits in person in the mornings. So we are separating out our clinics for well and sick or COVID-like visits. The morning will be the well visits. The afternoon will have clinics for COVID-like symptom illnesses. All students will be required to mask for in-person visits. We do have the COVID-19 testing in-house, the point of care, the Abbott ID Now, which is a molecular test. We can also send out for other PCR testing as needed. We do billing for symptomatic and asymptomatic testing, not only for COVID, but we also have to bill for certain other tests that go out to Quest Labs. Our influenza clinics, we will have an in-house clinic, influenza clinic on September 28th, and we'll provide you with more information about that. We also have an outside vendor planning to come in October. I think it is October 19th, but we will keep you apprised of that as well. Our office hours are 8 a.m. to 12 p.m. and in the afternoon, it's 1 to 4 p.m. We will have weekend hours again this year, and those will all be telehealth, 10 a.m. to 12 p.m. for the fall semester. And what we'll do is we'll have you schedule that online, and that will be able to be accessed Friday afternoon. All other visits, whether they're for in-person or well visits, to make an appointment, we ask that you call our clinic. Next slide, please. For our staff, we have 2 full-time nurse practitioners, 1 part-time internal medicine physician, 1 registered nurse, 1 laboratory technologist, and 1 administrative assistant receptionist. And we also currently have 4 on-call nurse practitioners that we can access if we need to. Next slide, please. As Ami stated, the health portal you should be familiar with. You should have completed all your health histories and your immunization requirements for measles, mumps, and rubella and TB, as well as uploading your vaccine documentation for COVID-19. We will be using a mobile self-check-in for students and for our telehealth appointments, as I referred to before. We will need all students to do symptom screenings, and the SCARF form will be needed for all students prior to being evaluated for COVID-like symptoms. As Ami said, we will reach out to you if you get a red on your SCARF, but if you haven't heard from us and you are having symptoms, feel free to call us first thing in the morning at 8 a.m. and we'll schedule that telehealth visit. The portal is also a place where you can access secure messages from providers about your health status, such as lab results. Next slide, please. Our after hours care, as Ami mentioned, there is a nurse consultation line when the clinic is closed. We also have local urgent care listings on our FAQ webpage on the health service website. The closest hospital is Oregon Health and Science University. It's a teaching hospital, provides excellent care, and we have good follow-up from them. So if you need to access that, we can do follow-up care post visit there. Transportation for ill students, there are options. There are the Zip cars, there's Uber. If you need emergency care, emergency services will take you via ambulance. But there's also transportation via radio cab, and campus safety, if you need them off hours, can help you with that. Or if you're in health service, we can help you during those hours. Next slide, please. Here's our contact information. If you have any questions, feel free to contact us. And I think that's all for me.
Thanks, Margaret.
And Francesca, can you advance the slide, please? So I'm actually going to just chat for a minute about some other testing issues. Margaret mostly covered this information, but I wanted to be sure people understood. You know, we do, as Margaret said, we do offer rapid testing for COVID in the health service for people who are symptomatic or people who are exposed. And so that's typically how we, you know, that's the most common thing. A person might need a test and it would be done in the health service during working hours. Once in a while, we will have a student who goes off campus for testing, right, and being diagnosed with COVID off campus. If that happens for you, and let's say it's after hours or on a weekend, what we ask is that you do report any positive test results that you had off campus at a healthcare provider. On weekdays, you can report that with the SCARF form. But if it's after hours or on a weekend, call campus safety. Campus safety has the most memorable number, campus extension that I can think of. Our last 4 digits are 7777, right? And so you can call campus safety. Let's say you were to be diagnosed with COVID over a weekend and you're going to need some extra support on campus, want to make sure that no one else gets infected from you, then call campus safety. Campus safety will actually page one of my staff, and our staff will reach out to you on the weekend to talk with you about what might next steps be. So we have lots of ways to support you around that, but it all starts with you staying in good communication with someone on campus, should you be diagnosed at some sort of off-campus provider. Next slide. All right, so that was about the symptomatic testing, right? And then I'll say just a quick word about asymptomatic testing. So when I say asymptomatic testing, for the purposes of this slide, it really means the kind of testing we're doing in the chapel this week. It means sort of surveillance testing, entrance testing. So to remind everybody, entrance testing is being required this year for all residential students. There are just a few exceptions, like if you've had COVID in the last 90 days. So there are a couple exceptions, but for most everybody, for people in residence, it's required. And today is the last day for new students to get tested. And if you don't comply, then unfortunately there are some consequences that will be coming your way. So don't get off on a bad foot in terms of the testing program. Come on over to the chapel today. You can sign up online. That was the information that was shared with you. I'm already seeing my phone light up with some text messages because our labs are currently being processed at a lab in Brooklyn, New York. All the 500 and some samples from yesterday are being processed in Brooklyn, New York. And if this goes according to form, sometime between tonight and tomorrow night, we'll get the results of yesterday's tests back, and we'll be in communication with those. So that's just a little bit of an update about asymptomatic testing. Next slide. Back to you, Ami.
Thanks, John. So let's talk a little bit about what happens if we do discover a COVID case within our community. You can advance the slide, Francesca. Perfect. So here's the big question. What if somebody tests positive for COVID on campus? The short answer is that if someone is identified as a positive COVID case, either through the big surveillance testing clinics that we're doing or one of the symptomatic testing opportunities that's available in the health service, we will support that person into special isolation housing that we have set aside, already made up, waiting for you in case we need to separate you from other folks to sort of ride out your illness. During that isolation period, students are provided with food deliveries, medical consultation, and academic accommodations that they might need. The duration of the isolation period is really dependent on the judgment by the healthcare provider, but typically an isolation period for a COVID case is 10 days, starting either the day that symptoms develop or a person tests positive, whichever comes first. And then after the 10 days, based on the judgment of the healthcare provider, people are typically allowed to be back with other people, although you do need to be cleared by the health service before you leave your isolation housing. The other thing that happens when someone tests positive is that we initiate contact tracing. We basically reach out to the person who is sick and figure out where they went, who they saw during their infectious period, and then support close contacts either into quarantine or connect them to testing based on what's appropriate for their situation. And we also follow up both people who are contacts and cases with case management and medical care throughout the entire period of isolation or quarantine, and make sure that they have everything that they need. Next slide. So the other big question is, what if you are exposed to someone who has COVID-19? Typically, we find out that someone was exposed either because a person reports their exposure through the SCARF form or is identified via the contact tracing process. And this is where it gets a little bit more complicated because the recommendations for vaccinated people and unvaccinated people are different. So if you are fully vaccinated, which means that it has been at least 2 weeks since your last dose of a COVID vaccine, right now, the public health governing bodies recommend that that person doesn't necessarily need to go into a quarantine period. They do need to get COVID tested 3 to 5 days after the exposure occurred. And until they get the results of that test back, they need to wear a mask. This says indoors, but starting today, actually in our county, you should be wearing a mask outdoors when social distancing is not possible too. You should wear that mask until around other people until you get a negative COVID test result back, or if you're not able to get tested right away, for a full 14 days after the exposure occurred. And if you are fully vaccinated and exposed to COVID, regardless of what your initial COVID test says, you also need to be self-monitoring for symptoms for a full 2 weeks after that exposure occurred, because we know that with COVID-19, it can take up to 2 weeks for someone who is exposed to either develop symptoms or test positive. If you are unvaccinated, the recommendation after exposure looks a lot like it did last year. So basically, if you find out you're exposed and you have not been vaccinated or not been fully vaccinated against COVID, we will support you into quarantine housing. We'll make sure that you have food delivery, medical consultation, and academic accommodations available to you. And we'll also initiate contact tracing for you to see if there's anyone else that may have been exposed who we need to notify. And I just will say, you know, as John said at the top of this presentation, we really have a near universal vaccination rate among our students and our staff at Lewis and Clark this fall. But we do have this quarantine process in place because there are students who have been issued an approved exemption or who might still be in process of getting vaccinated. And we need to make sure that we have options that will protect everyone regardless of where they're at in that process. And then I'll talk a little bit about contact tracing just to kind of demystify it. Francesca, you want to go to the next slide? So contact tracing at Lewis and Clark is basically the same as contact tracing that you may have heard of in the general community done by your county public health department. But the purpose of it is to identify people who may have been exposed to a disease and give them recommendations and resources that they need to avoid exposing others. So we at our wellness staff will work with the Multnomah County Health Department to identify and notify anyone who is deemed to be at risk of exposure because of a close contact. And we'll also find out where the person who was sick has been, so we can initiate disinfection and sanitizing of any potentially contaminated areas like a dorm common space or a classroom. I manage the contact tracing process here on campus. We have a few fantastic folks who are volunteering to assist with that process. And essentially, contact tracers will reach out via phone, text, email, secure message, like any way we can reach you. And we'll work with students to collect relevant information about your health, your recent activities. We'll assess your risk, and then we'll guide you through the appropriate next steps, whether that is quarantine, testing, etc. I will say here, I would love it. It would make me so happy if every single one of you watching this right now would go into your phone's voicemail inbox and make sure that it is not full and can accept voice messages. Because the number one problem that I've come across in contact tracing is, you know, we're all sort of trained not to answer phone calls if we don't recognize the number. And so oftentimes students, when I call, will not pick up. But then if their voicemail box is full, I can't leave a message and let them know that they might have been exposed to COVID and they actually have some really important stuff they need to do. So if you get a call from a Lewis and Clark number, which is a 503-768 blank, you should answer it. If you get a call from a number that you don't recognize and you feel safe answering it, you might want to do that as well, because it could be a contact tracer calling you. And please, please, please make sure that your voicemail box is accepting messages. So essentially, that's the contact tracing process. It's sort of an in-house process. The Multnomah County Health Department does contact tracing as well. But with with our on-staff contact tracers, we are able to respond far quicker and more nimbly than the county to contain a potential outbreak. And I really do think that our success as a college last year in containing COVID and having a very small number of positive cases on campus is somewhat attributable to our quick action as contact tracers. All right, next slide. So I also want to jump on here and just tell you a little bit more about health promotion and wellness services at Lewis and Clark that are not COVID related, because we have some wonderful programs that have predated COVID and are really exciting. So my office manages the Sexual and Interpersonal Violence Prevention and Response Program. This office also houses the Confidential Advocates Program, which are folks who are trained to provide confidential support for survivors and friends who are experiencing sexual or interpersonal violence. This office administrates EverFi, which is the Substance Abuse Education Service Program. And then we also do fun stuff throughout the year, health education workshops and trainings. We have some sun therapy lights for folks who have seasonal mood issues, which is super important in an Oregon winter. And then we also do manage the Public Health Ambassador Student Program, which we will be reaching out about later on in the semester. But if you have an interest in any of these programs, please visit our website on the Lewis and Clark webpage, the Health Promotion and Wellness website, to learn more. And I think that that is it for me.
So I'll just put a plug in, wellness services. We do have Instagram, Facebook, and Twitter accounts, and encourage you all to sign up. If you want to take a quick picture of these addresses to help in your sign up process, that's great. These are also available on our website. So I encourage you to follow us, and we use these to transmit the most recent updates on our programs to students. Next slide. So in addition to being Associate Dean for Health and Wellness and talking a lot about COVID issues, I'm actually the Chief Psychologist for the college, and I am a psychologist by training. And so I directly oversee our counseling service on campus. And so the counseling service is a really great place to get short-term counseling, referrals, and consultation for stress that you might be experiencing in your life. So if you'd like to chat with one of our staff, our staff is made up of psychologists, licensed psychologists. We have one licensed clinical social worker. Essentially, we're all licensed mental health professionals. We do have some residents from Oregon Health and Science University this year who will also be joining us. So as a team, we provide that short-term counseling, and it is confidential. So no one at the college can know what happened unless you sign a release that allows them to know what happened. Your parents can't know, guardians can't know, anything like that, unless you sign a release. Or there are a few exceptions. We review these exceptions with every student before they tell us anything. They're the same exceptions you would encounter if you saw a counselor in the community. So things like maybe related to imminent suicide risk, right? Sometimes we will have a duty to work with a student around that could involve a third party if we thought a student's life was imminently in danger. But those are the same kind of limitations you'd find in mental health services in the community. We operate according to those same standards. So if you're interested in talking with a counselor, call or email us to schedule your first appointment. All services do begin with a telemental health assessment via a secure Zoom platform. If you're ever in crisis, feel free to call us at that phone number at the top of this slide. Leaving a voicemail if necessary. We do not always answer our phones in real time, although we try to. We do close over the lunch hour each day. But if you have a situation that can't wait, we actually have a crisis line that's available 24/7, and especially after hours on weekends. And that's that number 503-265-7804. So there's always a crisis line number available to you. Our counseling services are free on campus, except for no-shows and also a limited number of appointments with our psychiatrist. That is a limited resource, so we do wind up referring many students off campus for psychiatry, but we do have a bit of psychiatry on campus, and we do charge some fees for that. As I mentioned earlier, our counseling on campus is generally brief counseling. For students who want longer-term relationship with a therapist, we can help with referrals off campus. And then you can see details there for our website and of course that after-hours crisis line. So that's just a little bit about our counseling service located in the lower floor of Templeton, but please do call before you come in. Next slide. So I know that we are running short on time, and so I will try to keep this really quick. I did notice there in the Q&A there was one question, so I'm going to kind of put a pause. Someone asked what if you're living off campus, and I think this was related to the COVID testing. So the entrance testing is not currently being required of students who are living off campus. It's only for students in residence. So hopefully that answered that question. So with that question answered, I'm going to just say, you know, students who are struggling, especially struggling maybe with stress or with emotions, usually as a psychologist, I'm not the first person they want to talk with. Usually they'll talk with a friend first. And so be a good friend to this community. Again, we're inclusive and a supportive community. If you're concerned about a friend, talk with your friend. Talk with your RA or your director about that friend. See if you can help that friend hook up confidentially with a counselor on campus. But if you're really worried about that friend, maybe like their life could be in danger due to maybe alcohol or drugs or suicide or an eating disorder or stalking, something quite serious, and your friend isn't willing to get the help that you think they might need, let's say from a confidential consultation with a counselor, I encourage you to go to that website, go.lclark.edu/win. And the Welfare Intervention Network is a team of people who can receive your report and then reach out in a supportive way to that friend and see if there's a way that we can get them to the help that they need. So do remember that. After hours, of course, if you're concerned about a friend, there's the phone number for campus safety or also the crisis counseling service. You can call and get a consultation about your friend from the crisis counseling service too. Next slide. Lastly, another role I have is managing student health insurance. What a boring topic, really, but it is an important one. We want everybody to have good health insurance just in case you need to go off campus and get care, or even if you come into the health service and you wind up receiving a service that there is a charge for. So the important things to remember is that you're automatically enrolled in student health insurance, but if you have other coverage that meets the college's criteria, you can waive enrollment in the student health insurance plan, but you have to do that by September 13th. So to waive, your coverage has to provide a range of healthcare in the area you're going to be studying. And so yeah, you all have been, will be charged for student health insurance unless you've completed the waiver. If you complete the waiver, then the charge is taken off your bill and all is well. So the student health insurance plan is a very good insurance plan, but it's not the best plan for everyone. So if you don't want that, be sure to complete the waiver by September 13th, because otherwise you will be charged upwards of $1,700 per semester. And you do only get one chance each year to complete that waiver. So be sure to get it done by September 13th. If you have anything different or special, unique circumstances come up this year around insurance, please email us in the student health insurance program, and we will work with you on your unique circumstances. Next slide. All right, and that's our content for today. So we do want to wish you best wishes for a safe, healthy, and successful semester. I'm just looking at the Q&A. It looks like there might have been one more question that arose. Who should I go to about psychiatric meds that I'm already taking when I need a refill? So I would say that your best plan would be to call into the counseling service, and our staff can talk with you about what the best options are for you with your individual circumstances. Sometimes our psychiatrists on campus can help with that. Oftentimes we wind up helping students make connections to psychiatry providers off campus. One of the challenges right now is that psychiatrists can take a while to get into. So we want to get you started to make that connection so that there's plenty of time to get you the appointments that you need. I forgot one important thing too, and I'll just throw this in at the end, and that is that We do know that it's hard sometimes to have a confidential space to talk with a healthcare provider. I think I passed this over on one of my earlier slides. So within the counseling service in our health promotion area, we do have some rooms. We affectionately call them our Zoom rooms. And these are rooms that you can reserve in advance if you want a confidential place to talk with a counselor, perhaps a counselor who's on campus that you're doing telehealth with, or perhaps a counselor or another healthcare provider off campus that you're going to see, but you don't have another confidential space to meet with them. So if you would like to do that, please call our health promotion desk starting next week. That number is, you can find it on our website, but it's 503-768-8225, and you can reserve a Zoom room. And that Zoom room will be a safe place where you can have a confidential consultation with a therapist or another healthcare provider. So I think we've answered all the questions and we've reached the end of our time. I hope that was helpful. Francesca, I'm not sure what the next stop is here. Can you guide us?
Absolutely. Thank you so much, John. All right, we have one final presentation for you students before we wrap up today with this session. We will be hearing from student accounts because financial and monetary health is just as important as the other things we heard about today. So with that being said, I will be presenting the video on behalf of the Student and Departmental Account Services Office. I will also drop the link to the video in this Zoom meeting. So if you are having some internet connectivity issues, you can always view the video on the New Student Orientation YouTube channel. With that being said, give me one moment to share my screen.
Hello everyone, and welcome to Lewis and Clark College. My name is Carrie Barnes, Interim Director of Student Accounts and Student Account Coordinator. During this presentation, you will be introduced to the Student Account staff members, provided with some very important dates to take note of. I will share with you the information you can access from the Student Account Center, show you where you can complete the health insurance waiver, as well as the green energy and media fee opt-out. And finally, I will share with you the final deadline for students to make sure their account balances are paid in order to avoid a registration hold. Our office can be reached at accountservices@lclark.edu. Jolie Allen and Vivian Schmolke split the alphabet when assisting students based on the student's last name. Lisa Milner is our cashier, and she is often responding to the emails that come into accountservices@lclark.edu. Important days to remember are the Fall 2021 fee payment deadline of August 12th. The last day to waive the student health insurance is September 13th for the academic year. The last day to waive the green energy and media fee is also September 13th. If you're on a payment plan for the fall semester, you'll want to remember November 5th is the last payment for the fall semester. And in looking ahead, the payment deadline for the spring 2022 semester will be December 9th. Student account information is accessible through the Student Account Center. When a student logs into lclark.afford.com with their credentials, they first come to a summary screen. Here, you will see the tabs along the top that allow you to detail in to access more information. On this first screen, you will also see the total amount due after pending financial aid or payment plans. Off to the right are important dates and the contact information for Nelnet TMS, our third-party servicer for the Student Account Center. On the top right, you'll see where you can provide access, we call it shared access, to a parent or guardian by clicking on this. In this invite screen, you will enter your parents, guardian, or the responsible party of your account that you wish to provide access to your account details. Once you submit this information, the person you want to have shared access will receive an invite to the Student Account Center and be asked to create credentials of their own to access your student account information. I encourage you to establish access early, as we will be unable to speak with any other party than you about your account information if shared access is not given. Next, if you click on Pending Financial Aid from the main summary screen, you will be able to detail into the financial aid information. Here, you will see the fully processed financial aid. This is the aid that has not posted to the student account yet, but is ready to post once we begin processing. The unprocessed financial aid on the right is aid that a student is eligible for, but there is still action required for the aid to fully process. Often, this is because you still need to complete a master promissory note or entrance counseling. Should you have any questions about the unprocessed financial aid, please contact the Financial Aid Office at fao@lclark.edu. The contact information is also on the bottom right of this slide. From the Student Account Center, you are also able to view details of your account activity by clicking on the account activity at the top. This provides a live breakdown of current activity on your student account. Next, students also receive a monthly e-bill emailed to them asking them to log into the Student Account Center and click on Statements. This PDF will provide you a snapshot of your student account activity at the time the document was created. If you have provided shared access to another party and they have created their credentials for the Student Account Center, they will also get an email when a monthly e-bill is available for view. Please remember this is only a snapshot in time. You can always see the most current live information by clicking on the Account Activity tab. Students wishing to pay their tuition and fees over the course of the semester have the option of a 5-month payment plan managed through Nelnet, which has a $40 setup fee, but there is no interest charge for this plan. The fall plan started on July 5th and ends on November 5th. Other payment options are to pay in full via credit or debit cards that are subject to a 2.99% convenience fee, or pay using a checking or savings account which does not have an associated fee, or remitting via Flywire for international funds transfers. The last tab within the Student Account Center is for setting up your refund preference. To establish direct deposit, you'll need to provide your personal banking information. This will allow direct payment into your personal bank account if a refund is due for tuition and fees. Please note, all payments made on your student account are refunded directly to you in the case of an overpayment or withdrawal. Next, I'll share with you the website for waiving the student health insurance. Students who have comparable health insurance of their own may waive from participation in the LC-sponsored student health insurance. All students are initially charged for the student health insurance. Once the waiver is complete, the charge will then be removed from the student account within 24 to 72 hours. Students are provided one opportunity a year to waive coverage for the full academic year. The waiver must be completed by September 13th for this academic year. Other fees students can waive are the green energy and media fee. To waive these fees, you will log into WebAdvisor and from the main menu, click Student Initiatives Opt Out for Green Energy and Media Fee under the Financial Information header. Once you click on the box to not participate in the program, within 24 to 72 hours, the green energy and media fee will be removed from the student account. Like the student health insurance, for these fees to be removed, you will need to complete this process by September 13th. Please be sure to note all account balances must be paid in full, covered by fully processed financial aid, or have a payment plan established by August 30th to avoid having a registration hold on the first day of the semester. I understand this is a lot of information, so please reach out to our office if you have any questions or need additional guidance. Thank you for your time, and we wish you a fantastic semester.
Alrighty, that's what we have for you all today,
Hi,
folks.
everyone. Good afternoon. My name is Francesca Span.
Apologies for that. Anyway, now you are free to go eat brunch and enjoy the rest of your day until you have sexual health and consent training later. In the meantime, don't forget to check out the orientation schedule and take a look at all of our fun evening events for this Friday evening. Thanks, everyone.